Good evening. Welcome to Wednesday Night Study Live, where we meet together to study addiction counselor exam practice questions. If you're new here, welcome. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. I provide mental health and substance use education and trainings. I also help future counselors like you study and pass their addiction counselor exams. Welcome, 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 and hello to the playback. As you come in, make sure you like the video. And if you're not already subscribed, please subscribe to the channel so that we get into the algorithm so other study partners can find us. I hope everyone is well this evening. Tonight's study questions is going to focus on ASAM versus DSM-5. Good evening, Jessica. Good evening, Colette. Good evening, everyone. Hope everyone is well. Come on in, join us, join us, join us. Okay. Go back. Good evening. Good evening. Welcome. Welcome. As you're coming in, guys, please like the video. Okay, again, welcome to Addiction Counseling Exam Study Group, where we review practice questions and improve our clinical reasoning. Welcome, study partners. Tonight, we'll answer questions based on ASAM criteria versus DSM-5. We'll review clinical reasoning by taking what we know foundationally about these two ways of assessing our clients and bringing it together. I'll read each question, I'll pause, then I'll reveal the answer. Well, you'll put your answers in the chat, and then I'll reveal the answer. So it's Q&A style. Again, hello playback. Even though you can't be with us live, it's all good. Make sure you put your answers in the comment section though. Don't cheat yourself. Okay, I'm going to look at the chat and then we'll go ahead and get started. Good evening, good evening, good evening, Doreen. Oh, no problem, Doreen. I'm usually back and forth between the questions in the chat, so I'll take a peek, but no worries. Work comes first. If you can't stay the whole time, just watch the playback. No worries. Okay, I'm going to go ahead and turn off my video and get started. All right, today we're focusing on 5 concepts that commonly appear on addiction counselor exams or drug counselor exams, alcohol and drug counselor certifications. You'll need to know the DSM-5 diagnostic criteria. We've worked on that for the past couple weeks. We did alcohol use disorder and we've also did opioid use disorder. You need to understand diagnostic criteria per the DSM-5 so you can recognize when a client meets the criteria for a substance use disorder and determine its severity. You also need to understand ASAM level of care and when each level is appropriate based on a client's need. A major exam topic is understanding the difference between a diagnosis and the level of care. These terms are not interchangeable, and many exam questions may be designed to test whether you know the difference. Or you may receive exam questions that will plop in something about the DSM-5 or diagnosis when you're really focusing on level of care. Hence why we're doing level of care versus diagnosis. We're synthesizing the information that we already know. The foundation of clinical reasoning is the ability to take that foundational knowledge that most of us know. So most of you know what level of care is. Most of you know what a diagnosis is. Most of you have heard of the ASAM criteria. Most of us have heard of the DSM-5. That's what we use to diagnose substance use disorders. However, how you kick up your studying or not is you synthesize the information you already know. You meld it together and you recall important facts about each. So if you get a question, you can quickly deduce what's the correct answer and what's not the correct answer. Hence how we get level of care versus diagnosis. So it's not to confuse you, it's just to kind of challenge you a little bit. Finally, we'll practice matching clients to the appropriate level of care using realistic case scenarios. The exam is designed to assess your clinical reasoning, so you need to evaluate the client's overall presentation rather than relying on the diagnosis alone. So let's get started. Good evening, everyone who've just joined us. So, specific exam focus. You'll need to know the DSMR diagnostic criteria. You also need to know ASAM level of care. Oh, I think I've already read this part, guys. Sorry. We'll also review, you'll need to know the 6 dimensions of the ASAM criteria and the levels of care.